He's dropping deep. Brady throws the ball to the right side. He's got a view open. Antonio Brown, 3-2-1. Touchdown, Tampa Bay Buccaneers.
Just about every sport you watch on television involves a game plan, with the end game being able to claim victory. Coaches create schemes and tactics weeks in advance designed to confuse and manipulate their opponent. In football, there are 11 players on the field for each team, and on many plays, 9 of the 11 players are completely irrelevant and inconsequential. But in order for that play to work and help create a touchdown, their actions become equally as important to executing the play as the quarterback, who throws the 40-yard touchdown to the receiver downfield. When it comes to the political situation happening in Canada over the past year and a half, the quarterback involved with creating and executing every single decision has of course been the Prime Minister of Canada, Justin Trudeau. Over the past 2 weeks, I've taken a dive into watching about 40 hours of footage of Trudeau's press conferences and interviews from March of 2020 right up until June of 2021. In doing my research, one thing that every Canadian must be made aware of and understand is that everything that has taken place since March of 2020 was done by design. There were no unfortunate happenings due to the spread of a virus, no once-in-a-lifetime coincidences like the people on television will lead you to believe. Everything you have experienced over the past year was 100% completely by design. Just like a football coach executing their game plan on Sunday, Justin Trudeau has laid out and executed his game plan with precision on the Canadian public with one simple goal in mind: get vaccines into the arms of every man, woman, and child, from the beaches of Tofino in British Columbia to St. John's, Newfoundland. Everyone must be injected.
Canadians have to get that one dose. Canadians have to get vaccinated to over 75%. And if we have those two things, if case numbers are down and if over 75% of people get vaccinated, we can have a summer that'll be much better for everyone. And that's sort of on all of us. Different orders of government. The federal government needs to make sure, as we are, that we have enough vaccines for everyone to get one dose before the end of June, which we will, and that second dose continues to increase.
Going back to Trudeau's press conference on March 11, 2020, this was the day Trudeau laid out his game plan on an unsuspecting Canadian public. In response to Canada's first recorded death due to COVID-19 of a man from BC in his 80s with dementia and several other comorbidities, Trudeau lays out a $1 billion response fund. He also uses this time to introduce Canada to the players he knows will be seen across our television screens and all over social media throughout the next year. There he is huddled, oddly, very close to Canada's Chief Public Health Officer, Theresa Tam, as well as Patty Hayjuk, Canada's Minister of Health, along with Chrystia Freeland, the Deputy Prime Minister. Until this point, all of these women were fairly unknown to most of the Canadian public, and so Trudeau borrows a tactic used by dozens of hip-hop record labels over the years, where they make sure their newest artist signed to the label is featured in the video of one of the more well-known rappers, so the public can become familiar with their faces. This is exactly what he's doing here on March 11 with Tam and Hayjuk, eagerly standing by his side, bursting with excitement, knowing full well their camera time is about to increase tenfold.
Patty, for Mr. Haydu.
Patty's fine. Patty's fine, sir. Thank you. We do call each other by our first names occasionally, so...
After showcasing the players who will be featured, Trudeau subtly lays out his endgame when he announces on March 11 he'll be providing $275 million for the development of vaccines and their research. Keep in mind, this was all in response to a handful of what we now know as cases and the death of one man in his 80s with several other major health issues.
It will also invest $275 million in additional funding for research and medical countermeasures, including vaccine development and support for clinical trials.
Make no mistake about it, the entire endgame of this contrived pandemic was solely based on getting vaccines into the arms of people all across the world. The why of all this remains to be seen as of yet, but the who, what, when, and how has become abundantly clear throughout the past year.
These vaccines will allow us to save millions of lives. They'll also have another enormous benefit. They'll allow us to develop a plan for the world to globally eliminate COVID-19.
Every single bit of fear you heard on TV and social media about cases, hospitalizations, and death was solely designed to convince you that taking one of the vaccines was the only way out to save your health and the lives of the people around you. It was just 12 days after Trudeau's March 11 press conference that he delivered his now infamous speech, which was designed to scare the Canadian public into believing there was a very dangerous pandemic happening all across the world.
Enough is enough. Go home and stay home. This is what we all need to be doing. And we're going to make sure this happens, whether by educating people more on the risks or by enforcing the rules, if that's needed. Nothing that could help is off the table.
On October 18, 2019, Johns Hopkins University, in association with the World Economic Forum and the Bill and Melinda Gates Foundation, hosted Event 201 in New York City. The event was labeled as a high-level exercise simulating a worldwide pandemic to see how cooperation between industry, national governments, and key international institutions would respond to stop the spread of a pandemic. The media and those involved with Event 201 expect you to believe that all those high-level government agencies, CEOs, and medical officials came together to strategize on how a fictional pandemic would play out in October of 2019, and then just 2 months later, an actual worldwide pandemic unfolded almost exactly how they scripted it at Event 201. The odds of all this being a coincidence is simply too ridiculous for words. Some of the key players highlighted at Event 201 include Timothy Grant Evans, who is the Dean of the School of Population and Global Health at McGill University in Montreal. Also in attendance was Adrian Thomas, Vice President of Johnson & Johnson, whom Canada later purchased 38 million doses of their COVID-19 vaccine from, along with Admiral Stephen C. Redd from the United States Naval Intelligence and the Center for Disease Control Prevention, also known as the CDC. And also at Event 201 was George Fugao, director of the Chinese CDC, as well as Christopher Elias, president of Global Development for the Bill and Melinda Gates Foundation, along with several other key figures from the media, banking, and business. One of the first order of business in their fictional scenario at Event 201 was to organize a plan on how to create vaccines and distribute them globally while bypassing all the usual government red tape and the trials that are normally involved before a vaccine can go to market and safely be used on human beings.
Before we agree that we have a finite resource, we need to really challenge ourselves on the vaccine production. We've seen historically that we can actually produce an Ebola vaccine in a year. It requires flexibility on the regulatory side. It requires commitment from companies. But I do think that before we say that a vaccine is not available, we should not slow down on that. We should pursue that. And I think similarly, we need to explore how could we accelerate production of our antivirals. We've seen it happen before in the HIV crisis. It's possible, but decisions need to be made, and we need to bring the right people together to do that.
I'm sure it's just another amazing coincidence that creating a rushed vaccine to market was one of their first order of businesses at the fictional scenario that unfolded in October of 2019.
Greetings, distinguished guests, and thank you for this opportunity to say a few words at this year's Event 201. If we move quickly, if we do the things we need to do, that does not need to be the history of this event. But if we don't take action, if we don't move, if we don't prepare, if we don't get ready, that may be a future that we have to experience and we have to endure.
Canada's Deputy Prime Minister, Chrystia Freeland, is a member of the Board of Trustees for the World Economic Forum and was named Foreign Policy Diplomat of the Year in 2018. Canada's Minister of Health, Patty Hajdu, spoke along with Freeland to the World Economic Forum in a closed-door session back in January 28, 2021, while Trudeau has openly discussed the Great Reset, which is the manifesto written by Klaus Schwab, the executive chairman of the World Economic Forum.
I just see the need for such a dialogue, and I see the need for action. I see the need for a Great Reset.
This pandemic has provided an opportunity for a reset.
One of the things I hear from people who have a hard time understanding how all of this has unfolded over the past year is that it's not possible for all these countries all over the world to coordinate this together. Well, at his March 18, 2020 press conference, Trudeau explains that collaboration and coordination with every province in Canada, as well as all G7 members, is essential to coordinating a pandemic response.
But whether we're talking about economic, travel, or health measures, collaboration and coordination remains essential. Our team is in constant communication with our colleagues in the provinces and territories, as well as Indigenous leaders and communities, to ensure that we have a coordinated, Canada-wide approach so we face this and recover from this together.
Trudeau was telling you who he's partnering with to make all of this happen. The G7 consists of Canada, the United States, United Kingdom, France, Germany, Italy, and Japan. Naysayers and skeptics will say, well, yeah, that's just 7 countries. How do they get all the other countries to go along with this? Well, from just 2018 until today in 2021, G7 countries have provided over $110 billion in economic aid to other countries around the world, with the biggest recipients of that money being India, along with Turkey, Afghanistan, Syria, Bangladesh, Morocco, Vietnam, Iraq, Indonesia, and several other African countries topping the list. If these poor countries go against the plan being laid out by the G7 countries, they'll risk any further financial contributions, putting their country's future at risk. In October of 2020, there was a reported leaked email from a member of the Liberal Party that outlines Trudeau's playbook of everything that will happen to Canadians from November of 2020 until the fall of 2021. That alleged email has been fact-checked by Reuters, who say it was a fake. However, almost everything in that alleged email played out exactly as detailed, but I'm sure it's all another amazing coincidence, just like everything that was detailed during the fictional Event 201. Some of the key points from the since debunked Liberal email from October 2020 included phased-in secondary lockdown restrictions on a rolling basis with major metropolitan areas first and expanding outward following, expected by November 2020.
Effective Monday, November 23rd at 12:01 a.m., Toronto and Peel will be moved into lockdown.
Daily new cases of COVID-19 will surge beyond capacity, including increases in COVID-related deaths following, expected by the end of November 2020.
I can't stress this enough. This situation is serious.
Prime Minister Justin Trudeau is worried about rising COVID-19 case counts. Single-day records for new cases were set Thursday in BC and Saskatchewan. And in Ontario, a single-day record for this second wave was set on Wednesday.
Complete and total secondary lockdown, much stricter than the first and second rolling lockdowns, expected by end of December 2020, early January 2021.
Effective immediately, Ontario is declaring a state of emergency. We expect this to remain in place for at least 28 days. Further, I'm issuing a stay-at-home order effective Thursday at 12:01 a.m.
Projected COVID-19 mutation leading to a third wave with much higher rate of infection and mortality expected by February 2021. Daily cases of the new COVID variant will exceed medical care facility capacities, expected Q1 to Q2 2021.
This Toronto hospital is jam-packed. That alarm ringing through the halls is code blue. A man in his 40s just arrived with a suspected case of COVID-19 and his heart stopped.
Transitioning individuals into the Universal Basic Income Program. Enhanced lockdown restrictions, referred to as a third lockdown, will be implemented with full travel restrictions, including inter-province and intercity.
To get ahead of the variants that are plaguing Western Canada, beginning Monday, we're setting up checkpoints at all interprovincial borders. We'll be limiting access to border crossings between Ontario and the provinces of Manitoba and Quebec.
Keep in mind, this supposedly fake email was circulating online in October 2020. That's an awful lot of foresight into the future for something deemed a fake. I know this is difficult for many people to understand, but everything you saw from the premiers and health officials in every single province across Canada was simply a smokescreen designed to manipulate you into taking one of the vaccines. The endless amount of press conferences, the masking and testing of perfectly healthy people, talk of overwhelmed hospitals, and dangerous so-called variants from all over the world, each one sounding more scary and dangerous than the next. All of this was used as a tactic to drive fear in order to make you think the only way to return life to normal was to be injected with a vaccine.
And the other thing we have to do is make sure that everyone is getting vaccinated. Getting the vaccination numbers up above 75% across the country is going to allow for a much better posture on reopening.
Trudeau has instructed premiers across Canada to close schools, churches, hockey rinks, soccer fields, barbershops, and hair salons, along with community centers, bars, and restaurants. Many of these restrictions that were put in place had most of the public wondering if the premiers and local health officials all across Canada are just making this stuff up as they go along, because most of it seemed to make little scientific sense at all. Unfortunately, the truth is, they were making most of it up as they went along, And all this was done to prevent Canadians from coming together and talking and just sharing their feelings about everything that's going on in their life. Putting Canadians in isolation was designed to break your willpower and spirit and to make you think the only way out of that depression and isolation was to line up for the vaccine to help life return to normal sooner than later.
In regards to when we're going to get to travel again, when things are going to go back to normal, that's the question we've been asking ourselves every month since last March. When is this going to be over? We're going to keep doing the things that will end it as quickly as possible. And that means staying home, staying safe, getting vaccines here as quickly as possible.
In spite of the fact that Canada has one of the best vaccination rates of their population of any country in the world, Trudeau is still refusing to provide any particular goal of how and when Canadians can expect life to return to normal. In more recent months, Trudeau's tone during press conferences has shifted dramatically. He's gone from cool as a cucumber and being very charismatic to almost desperation and begging the people of Canada to be afraid of the new variants and to line up for the vaccines. It's almost like he can sense the jig is almost up.
You know, it's amazing because we were talking about how important it was for everyone to get vaccinated and what a big deal it was to get vaccinated. So I thought that was all built in already, right. But getting that shot really was an amazing feeling. It hits you.
Did you cry?
I cry at, you know, I cry at movies. I didn't cry at the shot, but.
Dear Canada, you've been lied to and deceived, and it's laughable at this point that there's still a significant portion of the population who continue to listen to this nonsense being pumped at them through their TV screens and on social media. Our neighbors to the south in the United States are open with life back to normal in just about every corner of the country. Just last week, 135,000 fans packed the Indianapolis Speedway to watch the Indy 500, while the week before, massive crowds gathered in South Carolina to watch Phil Mickelson win the PGA Championship at age 50, along with hundreds of packed stadiums and arenas for college and professional sports all across the U.S. The same crowds at sporting and music events are also happening all over Europe in 2021. But here we are in Canada, begging local officials to simply open up a splash pad so 4 or 5 kids can cool themselves off on a hot summer's day. The longer Canadians continue to play along with this charade, the longer we will continue to be the most locked down nation in the Western world. The jig is up, Canada. Wake up.